Hi, I'm David Greene with the Florida Pain Network, where we connect those in pain with the best pain relievers throughout the state. And that includes Florida pain clinics and pain doctors, physical therapists, and chiropractors. The topic for today, degenerative disc disease. What is it? Who gets it? Is it painful? And what treatments are available for it? Degenerative disc disease affects millions of individuals in the United States every year. Most don't even know that they have it, and some are disabled from it. So what is it exactly? Well, what I have here is two views of the intervertebral disc. The first one is looking at the disc front on, okay? So here I depicted a vertebrae, lumbar 4, L4, and then L5. That's the bone. The disc is a shock absorber in between those bones, and it's made up of 80% water in a healthy individual. So what will happen is as you walk and run and whatever and put stresses on this disc, then some of that water, the 80%, gets pushed out to help absorb those stresses. And then the water comes back in, okay? So what you end up with is a very effective system that allows for huge range of motion and the capability to do those things without pain, usually, walking, running, things like that. What happens as we age, though? What happens as we age is that 80% water in the disc starts to go away. And your body ends up turning into what's called a prune. It's unfortunate but true. So people in their 30s, 40s, and 50s can get degenerative disc disease from losing that water and what happens from that. So here's what happens. I liken it to a tire that's getting flat. As you lose that water, you start to lose the height of the disc. So it may end up being only this is gone, right? So it may only being this high. But what happens is it starts to bulge out in 3 dimensions. And you get a bulging disc. And that may or may not be painful. Why might it be painful? Why might not it be painful? For that, let's look at the top-down view. So this is a disc looking at it from the top down, and the analogy is a jelly donut. So what you have is the inner part, which is the jelly, and that's called the nucleus, and it doesn't have any nerve endings, so it's not painful, okay? So what you have on the outer part of the donut, I get hungry every time I talk about this, is the annulus, and that does have nerve endings in it. So if it gets degenerative and you start to get some tearing in here, you can get pain. And that may be back pain, or it also may cause some of the jelly, if the tear is large enough, to squeeze out. It may hit a nerve root. Sciatica results from that, okay? So that's how you develop pain with degenerative disc disease, is that these nerve endings get irritated from a tear or tears, all right? So it may be pain that comes and goes every few times a year. It may be pain that comes and just doesn't go away. Some patients with degenerative disc disease are truly disabled from it. So what can be done about it? What are the best treatments? Well, the first treatment would be to not do the things that cause pain, such as if you're a big-time jogger and jogging flares up the pain, then just don't do that. Switch over to swimming or cycling. Another thing would be over-the-counter medications such as anti-inflammatories and Tylenol. They're inexpensive, you don't need a prescription. Make sure you take them according to manufacturer's dosing recommendation, but they can help if the pain flares up for a few days or whatnot. If the pain continues to get worse or you have a big-time flare-up, chiropractic treatment or physical therapy can make all the difference. They can give you a home program to do, the spinal manipulations can help, and what you'll find is that if you can incorporate stretching and strengthening of the lumbar spine into a home regimen, you can decrease the incidence of these back pain flare-ups from happening. Also, studies looking at degenerative disc disease treatment have shown that aerobic exercise, such as cycling and swimming, have been shown by far to be the best treatments out there for degenerative disc disease. So if those treatments are being done, and it's not exactly cutting it, so to speak, then treatment with an interventional pain management doctor can help a lot. Now, narcotics for degenerative disc disease chronically are not a good idea. Acutely, it can be okay, a few days to a few weeks, and then, get off of those. But the benefits do not outweigh the risks when you look at a long-term, narcotic treatments, okay? So when you start looking at interventional treatments, they tried a treatment years ago called IDET, which I'll show you, was a treatment that went into the disc itself. They put a coil into the jelly area and then heated it up. It's called intradiscal electrothermal treatment. It didn't work so great, so insurance companies stopped paying for it. So some treatment centers still do it, but the problem is that the heat doesn't get out to the outer parts of the disc, and a lot of times you can't treat the disease effectively. So that's really not a good option anymore. Some pain doctors will still inject numbing medicine and steroid into the disc itself, and that can give some pain relief for a few weeks to a few months. One of the problems that degenerative disc disease can cause is abnormal motion in the spine that can lead to pain in the back areas called the facet joints. So someone's like, well, the disc is causing all my pain. Not necessarily. If you do a facet injection on those patients, or what's called a radiofrequency ablation of the facet joints, a lot of times that can take care of 50% of the pain or more, because it's not just the disc that's causing the problem. There are some clinical trials going on for stem cell injections into the disc. We have one of those here in Phoenix. There's plenty of information on my website at preferredpaincenter.com about that, and that may help dramatically, but the study's ongoing right now, so if you want to look into being in that study, just check our website. In addition to that, as a very last resort, surgery can be contemplated after 6 to 12 months of conservative treatment. There's two options: spinal fusion or artificial disc replacement. Spinal fusion has been the gold standard for degenerative disc disease for decades in the U.S. as a surgical option. How well does it work? 50 to 75% at getting rid of 50 to 75% of a patient's pain. So it's not a home run. It's more of a roll of the dice kind of a situation. And they tried artificial disc replacement, and it's FDA approved, but the results are equivalent. They're not better so far. So is it better? We're not sure. A lot of patients end up needing further surgeries down the road after spinal surgery for degenerative disc disease. So thankfully, more than 80% of patients are able to avoid surgery and maintain a baseline level of discomfort that comes and goes, but they're able to play with their kids, work, and enjoy life doing these treatments that I mentioned. So on our website, preferredpaincenter.com, there's a lot of information there. The pain doctors and chiropractors that we recommend now are on the site at Arizona Pain Specialist. We'll get you in within 24 hours, guaranteed, in the chiro and rehab side. They're award-winning, board-certified, Patient's Choice, Best of Phoenix Magazine multiple years in a row. I'm Dr. David Greene, preferredpaincenter.com. Your pain stops here.